Dr. Jaffe, hot in the news, Bradykinin. What's up with that and COVID? Let's hear it straight from you. We want to get this message out.
Absolutely. Let's start with what are the basic words. Kinins, bradykinin, catastrophe and coagulation, and how are they all related? Well, kinins are a very interesting family or class of polypeptides, so they're proteins with sugar stuck on them. And they were discovered, probably in the late 60s, early 70s, when I was basically matriculating into scientific medicine. So they've been known for a long time. But in clinical medicine, they're only recently of interest. And they have powerful effects on the body. Bradykinin, like slow kinin, bradykinin slows your heart rate and lowers your blood pressure and opens your blood vessels. It causes vasodilatation. Now, what is the link between bradykinin and COVID-19? Well, and this is really quite new information, at least it's new to me. When you look at the coat protein of COVID-19, and the coat protein is the part that docks or connects or links to the cell, the place where it aligns, the place where it connects, is known by the acronym ACE2, ACE2. And it turns out that this is a kinin responsive receptor. And so with very high-powered computers and elegant technology, some scientists looked at the coat, looked at what's going on, and they have the hypothesis that part of what makes COVID-19 so potentially catastrophic is that maybe bradykinin and other kinins are released because vitamin C goes to zero, the redox potential, the oxidation reduction potential goes up. This makes the cells much more sensitive to the kinins. The probability of blood pressure going down too much, because you actually want your blood pressure to not be too high, but certainly not be too low. In patients whose vitamin C has dropped to zero and who have cell acid excess, cell metabolic acidosis, which really is a fancy way of saying they lack the mineral magnesium, mostly because the channel that takes it up in the intestines is itself impaired. And we have, with the use of choline citrate, an ability to enhance uptake through tiny micelles called nanodroplets that are taken up through neutral pores when the normal ion channel is saturated or even inhibited. And we have lots of clinical anecdotes. We even have some scientific evidence that's still coming, if you will, out of the clinic that is very encouraging. That when you take the amount of ascorbate you need, it must be nature's fully buffered, fully reduced L-ascorbate. When you take the amount of ascorbate you need, based on your C cleanse, when you check your urine after rest and you adjust your intake of magnesium and choline citrate based on the urine pH, you can correct these problems. If you do this early on, you can prevent a catastrophe because the bradykinin will not rise. The adrenaline will not go too high. The consequences of absent ascorbate, oxidative bursts that cause the antioxidant, the mother antioxidant, the maternal antioxidant that sacrifices herself that all other antioxidants can be regenerated. That ascorbate vitamin C molecule can go to undetectable. And that's a problem. And if you combine that with a lack of magnesium, that's double trouble. And now you would worry about comorbidities, because it's the people with comorbidities who are at risk. We postulated this before. We are now very confident, based on other people's evidence, that it is the people with comorbidities, regardless of their birth age. It's not about age. It's about comorbidities such as prior impairment of your lungs due to air pollution, vaping, tobacco, or other similar environmental irritants. Issues of your heart, especially needing certain heart medicines for high blood pressure or other heart issues. It's not the medicine that causes the problem in this case. It's the need for the medicine reflecting an impaired heart that itself is more susceptible to burden, distress, oxidative damage. And in regard to blood vessels, when the vitamin C goes down and the magnesium goes down, the endothelial cells fall off, the platelets start activating, and you get blood clotting. You can get stroke, you can get thrombosis, you can get pulmonary emboli. Actually, you can explain essentially all of the many consequences from the microvascular to the macro level on the basis of these people ran out of vitamin C and ran out of magnesium. And there are now studies, although they're small in number and relatively recently done, of course, that suggest if you give enough oral or intravenous vitamin C in symptomatic people, you can reduce their risks. You can reduce how many of them need to be, say, put on a ventilator. You can reduce the post-COVID consequences by recognizing the upstream cause rather than managing the downstream consequences.